Okay. Good morning, everyone. This is Dr. Bhupesh from Dr. BKM Institutes. Welcome to all the senior doctors and specialists. And being the masters of your field, OET is not going to be a challenge for you. It's just about understanding this pattern in the nice way so that we don't have to do it again. So what we are doing today, always start your OET letter. I will try to make it crisp rather than getting into formalities. I will try to make this lecture concise so that it can be a good recording related to OET writing only, and so that you guys can learn using the info. Always start your OET letter from the last. Always start from the last. So basically start from here. Using the information in the case notes, write a referral letter to Dr. Harry Smith. So you have to write a letter to Dr. Harry Smith at Royal Melbourne Hospital, Flemington Road, Parkville. In your answer, expand the relevant case notes into the complete sentences. That is what they want from you. In OET, all the information will be given to you in the notes form. So you have to convert them into the complete sentences. That is what they want. So grammar will play a very important role. If grammar would not have been involved in OET writing, you would not have required the coaching. I know you know grammar, but normally we are very much in a habit of writing in notes form. So we have to convert them into complete sentences, use the right subject, helping verbs that we will learn on the way. Do not use note form. The body of the letter should be approximately 180 to 200 words. The second thing that we have to understand in OET, and being senior doctors, you all know that data selection plays a very important role. Suppose if today I am writing the letter to gastrointestinal surgeon, if in the social history it is given that patient lives alone, then there is no purpose of writing it to gastrointestinal surgeon, especially when he has to assess for operation. So if we would have been writing to the psychiatrist, then in social history, if it is said patient lives alone, patient is depressed, then it means something. But when we are writing to the gastrointestinal surgeon, it does not mean anything. So that is how the data is selected. So refer, and this letter is very difficult letter. If you write all the words of this letter will go up to 300 words. So that is why I have chosen this difficult letter, so as to make you understand, so that we do not have to invest time again and again. So this letter will complete our 80% of the syllabus that normally comes to the doctors, that is visit letter pattern. So it would be in the form of visits that I will discuss along the way. So again, so we are writing to the Dr. Harry Smith. He is a gastrointestinal surgeon for the assessment of operations. So always start your letter from the last visit. So purpose, I have got to know. Purpose, I have already found that I have to write to gastrointestinal surgeon for assessment of operation, that is fundoplication. That is why I am writing the letter. So this is the purpose of the letter, means my first paragraph. The last visit is always today's visit. So today's visit is 23 January 2010. Today, the patient is asymptomatic, but continues to take regular omeprazole. So patient is taking omeprazole for something. She wants to stop therapy. Taking on the board lifestyle changes. Taking on the board means that she is in a process of making lifestyle changes. She has already stopped smoking, but she is worried to take tablets for the rest of the life, as she is taking regular omeprazole. So she doesn't want to take regular omeprazole. On examination, no abnormality has been found. That is what we will talk about grammar as well. No abnormality has been found. So she is being referred to you, and she is being referred to you for the assessment for operation of fundoplication. So basically now she is asymptomatic. Maybe she had some problem. In the last visit, we can see that she had Barrett's esophagus. And for this, we gave her omeprazole and gaviscon. Now she is better with the medications, but she doesn't want to take medications for the rest of the life. That is why the patient is being referred to you. So talking about the purpose, if I write it precisely, so I can understand the purpose from the last visit. So we can understand OET writing. Last visit is good enough to find out the purpose. So first paragraph can be prepared by this thing. So I don't know the name of the lady until now, but of course, I'm just telling you how to write the first paragraph. And this paragraph is the most important because we are writing the purpose. This letter is being written regarding Mrs. Y. Mrs. Y. No full stop, nothing is required after Mrs. No full stop, no. So Mrs. Y, I will write the right name, and second name would be used. So suppose if the name would be Geraldine Chapman. So I will say Mrs. Chapman. So whatever the name would be, I hope it is Clooney. So this letter is being written regarding Miss Clooney, who was diagnosed with Barrett's esophagus. So that is the main thing. So I have to write the purpose. So I will let the surgeon know, gastrointestinal surgeon know, that who was diagnosed with Barrett's esophagus. So regular omeprazole was commenced. So that is the main thing. Now means today. Now again you have to write in your normal language, but complete your sentences. That is what it is all about. Grammar. Who was diagnosed, that is a passive voice in the past. That means who was diagnosed by us. So who was diagnosed with Barrett's esophagus, so regular omeprazole was commenced. That is again a passive voice, was plus third form. That means by us. Now with the help of medications, she is asymptomatic. That is the first paragraph. She is asymptomatic. That is how simple OET is. However, don't use but. OET says don't use but, then there is a full stop. So you need to use a complex connector, that is however. However, now with the help of she is in however, she wants, yeah, she doesn't want. She doesn't want to continue the medication for the rest of her life. Therefore, she is being referred under your expertise, and also it is requested to you to assess her for fundoplication. So that is how simple OET is. That is your first paragraph. So I've made the summary. How did I make the summary? It's simple, that patient was having this problem. So regular medication was given. Now with the help of medication, she is asymptomatic. That means condition has improved. However, now the problem is that she doesn't want to take the medication. So that is why we need your expertise. And also it is requested to you to assess her for fundoplication. The second important thing would be commas before the connector. Before the connector. Now with the help of medications, she is symptomatic. So wherever I take the breath, apart from the connectors, wherever I want to stop. Now with the help of medications, she is asymptomatic. Full stop. However, comma, she doesn't want to continue. Does with does, you do not say wants. So we have used the S over here. Small things, obviously, you know, I'm just teaching the way I teach. There are many things you already know, but to make it convenient for you. So she wants to continue, doesn't want to continue. Therefore, she is being referred, and also it is requested to assess. So that is the first paragraph. Second paragraph is about social history and medical history according to what is required. It is not necessary that we must write. It is not important. If it is not important, then we will not write. If it is relevant, only then we will write. So I will mention the word relevant over here. Relevant social medical history, second paragraph. Third paragraph starts with on first visit, whatever happened. Then next paragraph on second visit, whatever happened. We can combine the visits as well according to the preference. On third visit, in this letter we have 4 visits, and then today. So we can combine these. We don't have to make 6 paragraphs. If these 2 paragraphs can be made smaller, so we will say on first 2 visits. So this is your skills, your smartness according to what you like. Again, the primary thing is purpose, followed by the relevant social history and medical history. Then on the first 2 visits, on third visit, today according to whatever has been given. So let's go to the letter and try to write the rest of the letter as well. So taking it forward, first paragraph has been completed. Now always after today visit, always go to the straight away after finding the purpose, go to the first. So this is why I was saying this letter is such a big letter. If we will write everything, this will go to up to 300 words, but we are allowed to write only 180 to 200 words. So that is why we have to be precise with our words calculation. Again, you don't have to be 100% precise. It can be around 210, that's fine. It can be around 190, that's fine. So now we will try to know about the patient. So patient says, it's Mrs. Lucy Clooney. Social history is a bank manager, heavy smoker. So this is important. This we will pick. Drinks alcohol occasionally. This we can pick. Past medical history is mild hypertension. Not taking medication, moderately overweight. Note, I don't really think that is important, but if you find anything relevant like overweight or maybe hypertension, if you find this way, hypertension can be told because during operation, a surgeon must be told about this thing. So we can use heavy smoker and mildly hypertensive. Then on the first visit, which was on 18th August, and the date of today is, the last date was 23rd January. That means he has been our patient since last 4 months. So the first time when he visited on 18th of August, he presented with discomfort in abdomen, burning sensation at the same area since her early 20s. So what is the age now? 1955, and now it is 2010. How did I know 2010? Because my today's visit date is 2010, January 2010. So if I deduct, if I subtract, just a second. Okay. If I subtract 1955 from 2010, it would be around 55 years of age. Yeah. So it would be around. So basically she is 55 years of age, have been smoking 20 cigarettes daily for 30 years. That means when she was around 25, that's where she started. And then, she is having discomfort in abdomen and all that stuff. Now taking it forward, just a second, the screen is not moving aptly, so I have to go back. Okay. Okay. So on the first visit, she had discomfort. That is the main thing that I want to tell you in this letter, that the first 2 visits, she had so many problems, burning sensation, especially meat and bread. Then on examination, no cervical lymph node swelling, this and this. So at that time, we felt that she was having dysphagia due to hiatus hernia or other organic lesions in the esophagus. So at that time, we thought that she is having this kind of problem like dysphagia or something. So we explained the possible diagnosis that you might have dysphagia due to either hiatus hernia or organic lesions. So she was advised to stop smoking and to adjust her lifestyle and to consider further investigation. But what she did, and she was told to come back after 2 weeks. But what the patient did, she did not come after 2 weeks. Rather, she skipped her visit. She came after 3 months, 18th, 8th, 20th November. So August, September, October, November. She came in November, missed the review visit. Her symptoms worsened. Increased difficulty in swallowing, regurgitating undigested solid foods, but no pain on swallowing. Concerned about her weight loss, she lost 5 kgs in 3 months. Antacids taken by self, not effective. So she is taking antacids as well. On examination, everything was normal. So she was assessed with either hiatus hernia or mass in esophagus, just like the last time. And she was advised to undergo x-ray because she did not undergo investigation at that point of time when we advised her in the last visit. So after 3 months, she has revisited with worsened symptoms. So she was referred to surgeon if abnormality was found. That was planned. So we planned that she should undergo these investigations and should go to the surgeon if abnormality is found. So after like 20th, after like 5 days, so this was after 3 months. So after like 5 days, no symptoms improved. Cough at night, sometimes being woken at sleep, productive cough, not able to do this and this. On examination, still normal, no malignancy, no evidence of aspiration, no pneumonia. ECG normal, but endoscopy revealed esophagitis and stricture with 36 centimeter incisor teeth showing small hiatus hernia. Biopsy consistent with esophagitis. So that is confirmed. So her endoscopy revealed esophagitis, which was also confirmed by biopsy, but no malignancy was found. So she was assessed with Barrett's esophagus. So we advised her to make lifestyle changes, to take medications, repeat endoscopy, and to undergo operation. Now, this is the most important thing that I want to address you. Why this letter is different? Because see, you all will understand this is the most important point. That is why we have considered this difficult letter, how to deduct the data. If the patient would not have been found with Barrett's esophagus, suppose if he would not have been diagnosed and the symptoms would not have improved, then to the gastrointestinal surgeon, I would have told everything. Sir, on the first visit, this happened. On the second visit, this happened. On third visit, this happened. I could not diagnose the patient. That's why I'm referring the patient for definitive diagnosis. But this letter is different. Normally, the letters are of such that, okay, on the first visit, this happened. On second visit, this happened. Today, this happened. So I suspect that he is having Barrett's esophagus. So that is why I'm referring the patient to you for definitive diagnosis. But this letter is different because definitive diagnosis has been found by us in the last visit. So what happened in the previous two visits does not hold importance. That is the most important point. So these two visits do not have too much importance for this surgeon because now we know he is having Barrett's esophagus and he is asymptomatic. That means the diagnosis is right. That is why after taking medications, symptoms are all right. But now the only problem is that she is worried to take tablets. So that is the only problem. That is why we made it the purpose. Otherwise, in the normal letters, I would explain you by writing. We will just have 10 minutes of 10 minutes of more concentration. That is what I require from your side. Just 10 minutes more. So normally letters are like this. The last visit would not have last visit would not have been given. Then we would have said this letter is being written regarding Mrs. Clooney, who has been suspected with. Then letter would have been very simple. That is why I chose a difficult letter so that on the first day we can cover the maximum. But if there would be any problem, we will come to the basics. If you do not understand anything, we will come to the basics. But I hope you would be able to. So who has been suspected with Barrett's esophagus on the basis of current signs and symptoms. So that is what I am saying. I'm just gonna unmute you as well after this line. This letter is being written regarding Mrs. Clooney, who has been suspected with on the basis of current signs and symptoms. So that we would have told that on the basis of current signs and symptoms, Miss Clooney has been suspected. That means probability. Therefore, she is being referred under your expertise for definitive diagnosis and further management. So these are the normal letters of OET, the easiest ones. Normally, 70% this kind of letter will come, this easy, that you will simply say to the surgeons that this patient has been suspected with this, therefore she is being referred under your expertise for definitive diagnosis and further management. So that is the normal letter. But in this letter, what happened is that in this case, we have diagnosed the patient. Medications have been given. Patient has been made asymptomatic. So we have done all the required jobs. So in these kind of letters, every visit would have been important to be explained. But in these kind of letters, the difficult letter, so we need to understand when the patient has been diagnosed with Barrett's esophagus on third visit, then first two visits do not have the importance. So we can deduct the data from those two visits. Now I will take your questions by unmuting you so that you can ask me anything. If by chance, in my hurry, if I have missed out anything, please, everybody can ask. Dr. Raja, Dr. Amy, Dr. Siddharth, Dr. Shalini.
Thank you, sir. Thank you for this class.
Mm-hmm.
This is Dr. Raja here.
Yes.
Sir, my doubt is like, so you clearly explained. So if the definitive diagnosis is not made, then the letter is very simple. For our case pertaining, the definitive diagnosis is there. So what exactly are we supposed to write in the first and the second visit? Are we supposed to elaborate the signs and symptoms, or just what are we supposed to write?
Suppose if there would be the letter about definitive diagnosis.
Yes, sir. Similar our case only, sir. In our case, sir, the first and second visit, what do we have to explain fully, or just write the important things like?
Yes, sir. The case will be dependent. The case will be dependent upon the letter. So it's
no, sir. For this case,
for
which
this,
you showed to us today.
Yeah, for this case, sir, these first two digits will not have too much of importance.
No. What should we write? I know it doesn't have too much of importance, but what are we supposed to write?
Sure, sir. I'm just going to take this forward. Should I go ahead? If you have understood up to this point, that is the second thing we are doing after first paragraph.
Oh, okay.
Right. All
Okay. Okay. Fine. Sorry. Okay. Then okay.
Surely, Dr. Raja, I'm just going to explain you this thing. So should
Yeah.
we go ahead, Dr. Siddharth, Dr. Shalini, Dr. Pulkit, Dr. Amy, Dr. Debashish, Dr. Harita, and Dr. Prithvi? Should
Yes,
we
yes.
go ahead? Okay. Thank you so much.
Sir,
Yes, please. Okay.
sir, can you just share that PDF file on the group so that we can see that PDF file, the question form?
Yeah, absolutely. Absolutely. You will be getting everything, sir. We would be all smooth. And I assure you, you would be getting each and every single bit of thing. You also need to write this letter by yourself afterwards. So we definitely will forward you.
Okay, sir. Thank you, sir.
Thank you so much, sir. Just 5 minutes more and everything would be done. Not in a, I'm not saying in a fast way because you doctors are at senior level. So I don't want to take your time. Otherwise, normally I do not rush things, but I know you would be able to understand. I will share this video as well. So there would not be any problem. And also we are available anytime. So now this letter is not of this kind. So I'm deducting this point at the moment. Everything is being recorded. So there is nothing to worry. So now this is my letter. So now social history I have told you. So I would say Mrs. Clooney. Mrs. Clooney. So main thing is smoking. Has been smoking 20 cigarettes. So this is the tense I would like to use. Has been smoking. This will give me extra points. Has been smoking cigarettes since last 30 years. Now this is very important because these are the small things we need to take care. Normally we write social history in the present tense, but in this letter what has happened in the last visit, it has been said she is asymptomatic and has stopped smoking. This was given in the last thing, and has stopped smoking. This was given in the last visit. So now these are the small thing we have to look forward and have to understand that if she has stopped smoking, so we cannot say has been smoking. So we should, Miss Clooney had been smoking 20 cigarettes since last 30 years. And she is a bank manager. This is important. Apart from this, or we can say she is mildly hypertensive as well. So that is the only thing I wanted to write from the social history and medical history, because I know this letter is huge. So I have to deduct data. So that is what I'm trying and do over here. So if the data would be relevant, if word count is not a problem, if small letter comes in the exam, I will try to write everything. But now I know that letter is already a big letter. There are too many words. So I have to restrict my words up to 200. So I will drop it here. So Miss Clooney had been smoking 20 since last 30 and she's a bank manager. She's mildly hypertensive as well. Done. So I've told about social and medical history, whatever I find on first visit. Only the important words. This can be anything. I would like to choose that she was having a burning sensation. She was having burning sensation and other gastric problems, I can say, or anything. If I want to pick anything from this, like I would go to the letter itself so that we can discuss few bit of things. I could have written that she was having discomfort in upper abdomen. Probably I would have chosen this word, or I would have said that difficulty in swallowing solid foods. So a couple of things from these. Then on examination, there was nothing great. So I will like to omit this thing. I will delete this thing. Then I will say she was, when it is given either or, that means suspected. It is not sure. That is why we are saying either or. So I will go back to this thing and will try to write this in a clear form. So I will take the page again. Again, it's on, this is the only hard work we are doing. Then in the OET letters, we will not have to do the hard work again. This is the first class and I just want to make it very simple. So she was having burning sensation and difficulty in swallowing food or other gastric problems. At that time, this is the perfect thing. At that time means on the first visit, she was assessed with, she was suspected with either hiatus hernia or organic lesions in the esophagus, whatever has been given. Therefore, she was advised to quit smoking and to make lifestyle changes. Again, I will take it back. Small things, it's just about small things. So therefore, I'm using after the full stop. So over here, when full stop is not there, I will like to convert this connector into so. I would try to avoid repetition. If it is important, if this is the only connector I have, then I would write, but otherwise I can say so. So it says try to avoid hence. So that is why I'm not using the word hence. So, but don't get complicated. If by chance you cannot remember anything, you can write hence, but OET says to avoid it. This, they call it outdated connectors. So I'm using the word so, and over with full stop, I am using the word therefore. So these are the small changes we have to notice again, but it is not very important. This will not stop your exam, but talking about OET and its bit of restrictions. So in the first visit, I have used only this thing, advice and adjust lifestyle and to consider further investigations. But then I don't have to write consider further investigations because again, she did not come. So then I would say on the second visit. Now letter will go smoothly. Now it's your choice. I am choosing these things. You can choose different symptoms than mine because you are a specialist and you are better than me in terms of data selection for sure. So use your own things, whatever suits you more. So therefore, she was advised to quit smoking and to make lifestyle changes. Further, she was also advised to undergo investigation. If I want to write, otherwise I can avoid. It's up to me. It's up to you basically. Further, she was advised to undergo few investigations and to come after and to come for review after 2 weeks. So this is the story I'm like. So after 3 months, she returned with worsening of symptoms. That is what has happened. Symptoms. So I can also write she missed her review appointment, but I do not want to use these data. She missed her review appointment and returned after 3 months. I can also write this way and returned after 3 months. It's all my choice, whatever I find. But again, story should be nice. So it's all going in a smooth flow. This is the purpose. Then it's all going as a story. Social history, medical history on first visit. Normally, social history or medical history is of 3-4 lines. So the first visit comes here. But when it is too small, it is just a single line, then I would like to merge it. Otherwise, I would have made it separate. So it's all about us. We need to write it nicely, sweetly, so that everybody can understand. That is the only purpose. Again, there is no complexion, no mugging up, no ratification. It's just about your things your way. So if it is a small line, I know it's very small. It doesn't look like a good paragraph. So I try to mix it up. If it would have been 3-4 lines, I make it this way. So, and returned after 3 months with worsening symptoms. Yeah, with worsened symptoms, I can also say. Again, it comes to that English basics. This we will talk when we will have the individual classes. So today is the class for just a kind of a pattern class for writing. So she missed her and returned after 3 months with worsened symptoms. So again, she was advised. So she was advised again. This would be more, she was advised again to undergo investigations. It's simple. You can merge any visit. Then I know the story goes this way, investigations. So on third visit, that means after 5 days, her endoscopy revealed, only pick only what is important. Don't this was normal, this was normal. Don't talk about those things, because then letter will become too much of too much words, which is not nice for us. So after 5 days, her endoscopy revealed esophagitis, which was also confirmed by her biopsy. So this is my English. Again, your English can be different. You can make it 2 lines that, her endoscopy revealed esophagitis and biopsy also revealed the same. You can also write this way, but this is how I would like to put the connector, which was also confirmed by her biopsy, which was also confirmed in her biopsy. Yeah, which was also confirmed through her biopsy. Then so at that time we can say, or we can say therefore, that on the basis of these consistencies, therefore she was assessed with Barrett's esophagus. Simple. Now the letter, we are coming to the end of the letter. This is the only time total we are having this class where I am making you understand as well. It has taken us only 35 minutes. In exam you will have 45 minutes, and you will be the only one who needs to write. So it hardly takes 25 minutes in the exam. But again, data selection is very important. Complete sentences are very important. Commas, connectors, small things. So these are the things you need to take care of. You will get 45 minutes. 5 minutes they will not allow you to pick pencil. After 5 minutes, there would be 40 minutes to write. So in the first 5 minutes, they want you to analyze the letter. What would you like to write? And you will not be allowed to pick the pencils. So which was, and only one letter will come, only one task. So that is how easy OET is. But at the same time, these things need to be taken care of. So she was assessed with Barrett's esophagus and Gaviscon and omeprazole. And though it doesn't look nice to use two ends, so I would say along with omeprazole were commenced. Yes, sir. Now it becomes even simpler. Now we are coming to today's visit. Today, and also she was again informed or advised, but advised word is coming again. She was again suggested. Suggested is no, it seems to be an official word, not for the medical terminology, so that's why I'm not using it. Recommended. She was again recommended, or suggested also is fine. If you feel it's fine. She was again recommended to stop smoking. Today, now I would like to merge this line. So I was it today. She has stopped smoking and is making and is taking on the board other lifestyle changes as well. This is how I'm mixing up the data. Whatever I want to mix up, I'm creating my own story, but from the same data. I'm not creating my data. I'm creating my story from the same data. There will not be even a single line which I am making myself. Everything would be from the letter itself. So she has stopped smoking and taking on the board lifestyle changes. As a result, she's asymptomatic. And also, sorry, further, she is taking medications as well. And as a result यही हुआ that she is asymptomatic. However, again, this line would be repeated. These are the few lines, which is the purpose line, would be repeated. However, she doesn't want to continue, but I still would like to make some paraphrasing, do some paraphrasing about it. However, she's reluctant. So I will just try to shuffle the word. She's reluctant or she's not interested. And taking medications on regular basis. So just shuffling the words around. So she is being referred under your expertise. About smoothness of the letter. Or you can say, or you can simply say, so your expertise is highly required. Again, shuffling the words because over we said she is being referred, so I'm just shuffling the. So your expertise would be highly appreciated in this case. Your expertise would be highly appreciated. Please note. Yeah, it is also requested to you. It is also requested to you. Or otherwise we can say, but again, I don't want to say assessment for fundo application is also required. Yeah, also I'm using again and again. So fund assessment for fund application is required as well. So that is my complete letter. Now, when I have written the letter, I will just like to read the flow of the letter. Let's see what we have created in the final exam. This letter is being written regarding Mrs. Clooney, who was diagnosed with Barrett's esophagus. So regular omeprazole was commenced. Now, with the help of medication, she is asymptomatic. However, she doesn't want to continue. So that's my purpose. Miss Clooney had been smoking 20 cigarettes since last, and she is a bank manager. She is mitral hypertensive as well. On first visit, she was having burning sensation and other gastric problems. At that time, she was suspected with either hiatus hernia or organic lesion in esophagus. Therefore, she was advised to quit smoking and to make lifestyle changes. Further, she was also advised to undergo few investigations and to come for review after 2 weeks. She missed her review appointment and returned after 3 months with worsened symptoms. So she was advised again to undergo investigations. Undergo should be together. Yeah. After 5 days, her endoscopy revealed esophagitis, which was also confirmed through her biopsy. Therefore, she was assessed with Barrett's esophagus, and Gaviscon was along with should not be with were should be with was. Gaviscon along with omeprazole was commenced. She again was recommended to stop smoking. Today, she has stopped smoking and is taking on lifestyle changes. Further, she is taking medication as well, and as a result, that is not required. As a result, she is asymptomatic. How she is not interested in taking medications on a regular basis. So your expertise would be highly appreciated. Assessment for fund application is also required as well. Complete, perfect letter. Sounds like complete flow. It takes only 2 minutes for the examiner to read it. The lesser time he needs to read your letter, the best it is. So this is about OET visit letter. The only now we will practice few visit letters one by one, and then we will go to the discharge back letters, which we talked in the last class. There would be kind of letters where would be patient would be discharged back to the same doctor, in which medical history and social history will not be required because it is the same doctor from where the patient came. So he already knows about social history and medical history. So these are the two major letters for the doctors. But anyhow, I would like to take your doubts for this session. Please ask me for any doubt whatsoever. If you have understood this letter, our 80% of OET writing is done, and you just need to write it yourself. I will send you this sample. I will send you this recording. I will send you the final sample as well, which we have created, and the question paper as well. So please, any doubts you can ask me. Any doubts, please. And then we are leaving. Just your yes or no, hi and this, and whatever you would like to ask, please. Dr. Shalini, Siddharth, Dr. Prithvi, Pulkit sir, Haritha ma'am, Tabshish sir, Amy sir, and Dr. Raja. Anything? Yes, please. Yes, Dr. Amy. I think I have forgot to unmute you. That is why it is creating problem. That's my fault. I'm really sorry. Yes, please. Sorry.
So regarding number, should
Yeah.
we write the numerical forms or should I write the words of the
Sir,
numbers?
when we are commencing a sentence, when we are starting a sentence, numerical form will not look nice. Like if I say 6 months later, but if we are writing in the middle, then it's absolutely fine to write numerical.
Okay. Also regarding short forms, for the word and, can you write that and?
No, sir. No, sir. Try to write complete words. Just because we have 45 minutes, it's ample amount of time. So there is no point of writing, abbreviations or
Mhm.
other things. Any other question, please? Seems like you have understood everything, but still you can always ask me. So I'm just going to flick you the question.
Sir, also one more.
Yes, please, sir.
Should we opt for the on-paper OET exam or on computer-based OET
Sir,
exam?
it depends upon you. See, one of the doctors from the last time, I'm just going to stop the recording first. Okay, sorry.
Yeah.